Good afternoon. My name is Mario Vassaux. I'm the COO, CTO of Life365, and I would like to welcome you all to Season 4 of The New Normal. Today, our episode is engaging consumer/patients in their own care and the transitioning of care to the home. I would like to take a minute to thank you all for participating in this webinar and for joining us, and especially special thanks to our panelists for their time and their insights with us this afternoon. I will be introducing them shortly, but I'd like to let our attendees know that they will be on mute, but we will save some time towards the end of the webinar for questions, but feel free to use the question box on the app here to add your questions, and we will do everything we can to get to them. Also, as a reminder, you can re-listen to the webinar at www.newnormal.buzz. All right, and now on to introducing our distinguished panelists. This afternoon, we have Dr. Farrukh Jafri. He is the Medical Director of White Plains Hospital Cares. He's a board certified in emergency medicine and is skilled in clinical research, medical education, digital health, community outreach, patient safety, and quality improvement initiatives. His research interests include the use of technology to advance healthcare delivery, and is currently completing a PhD focused on quality and performance improvement from Harvard's MGH Institute of Health and Professions. Welcome to you, Dr. Jafri.
Yeah.
Our second panelist is Sean Elwell. He is the VP of Innovation at White Plains Hospital, and he is also the Managing Director of East Post Road Ventures. He is a solutions-focused leader with a deep background in value creation for startups and new ventures, in telehealth, consumer-facing digital engagement, and software platform development. He holds 7 utility patents related to embedded hardware devices and their manufacturing. He has expertise with raising funds through angels, VCs, private equity, and he holds experience as an entrepreneur, CEO, and executive board member and advisor for various organizations. Welcome to you.
Thank you. I appreciate you having me.
Good deal. So this will be very casual, but our topic really revolves around healthcare in the home. As we all know, COVID was a catalyst to really pushing digital health and self-care at home to the level where it's at right now. And from the perspective of a patient or perspective of a hospital, this has been something that has really changed things quite a bit. Again, perfect examples is we've all taken COVID tests at home, and who would have thought that we would be taking tests at home? and then of course, we always have RPM, remote patient monitoring, that's been out there for a while, that's really taken off, that allows patients to take their vitals and send them in electronically to portals, EHRs, hospitals, so that care providers, physicians, and clinicians can actually see real live data and react to it. Part of this includes virtual healthcare, telemedicine, and RPM. And so this is our topic for today. So basically, why don't I start with Dr. Jafri? And Dr. Jafri, what's your take on this?
Just in regards to remote patient monitoring and just digital health at home?
Digital healthcare at home, yeah.
It's expanding our opportunities to really open our impact to optimize healthcare, right? So, there's a frequently quoted statistic that 80% of healthcare outcomes happen outside of the four walls of the institution. And for somebody that's been trained within the four walls of that institution and taking on this new role in transitional care and digital health, it's really opened my eyes in regards to what potential impacts are available by expanding our access, which is really what patients need, access to care and services outside of really what the traditional paradigm has been in the past. And so, calling, making your appointment, coming in, getting your vital signs checked every couple of months. And, you may have white coat syndrome and then start getting diagnosed with hypertension after a couple of months, So I think the idea would be, how can we impact that access to care, and how can we impact health outcomes based on what the needs are for our community and for our hospital systems. So it's an exciting time, and I think the area really for us, and it's something we could even discuss today, is how do we optimize this to make it as seamless and frictionless for our patients, so that they can really take this on and have a active participatory role in their health. But also, how do we then take this data that's going to come in large aggregates and make it palatable for our physicians, right? So that they can easily act upon it and not just be, another alarm bell that's just constantly going off, which
Right.
Sometimes I still hear the ER when I go to bed at night. So, it's an important aspect of, how do we now make this seamless and not just make it an over preponderance of data.
Excellent, excellent. So we'll dissect that because I think there's some very good points there. All of those are great points. I think the one thing that comes to mind to me is, we invent these new tools, and there are these new tools, and it's one thing to create them. It's another thing to actually engage the patients, right? And get them involved in their care. But also, as you mentioned, we also have to keep in mind that we also have to make this digestible by the physicians, right? We can't overwhelm them with data. We need to make sure that data is pertinent. So before we go to that, then Sean, I'll give you the opportunity. Where do you see this, in your area of expertise and in your travels? Where do you see this care at home?
I've been an entrepreneur in this area for a long time, and one of the essential gatekeepers of success and progress in this area is always reimbursement. Can you get paid for it? So when I first started doing ventures in telehealth in the 2009 timeframe, those were dark days. The insurance companies weren't paying for it. It was a long way from that. The remote patient monitoring codes 99490 didn't come out till 2015. So it was very difficult to try to generate revenue in those days. You're going after basically patients with high deductible plans who were having to pay out of pocket, trying to appeal to them on a value-based ROI argument, which was just, it was tough. Psychologically, people want to use their insurance, even if the ROI argument is weak. And then, the 99490, if I'm quoting the CPT code correctly, the remote patient monitoring code came out 2015. A lot of people tried to jump on that bandwagon. And I think it was a little while before they could actually deliver real value on RPM. I'd say the early efforts were putting a lot of effort in, and the value was questionable early on. And COVID, of course, changed everything, but changed it for a time. And now we're on the backside of the COVID curve. And I think these are really interesting days. Like, how much of the COVID curve is going to stick? And also because CCM has been around since 2015. We're now seeing some pretty interesting and pretty mature RPM solutions that are making really strong ROI arguments. I was involved in a couple projects at Philips that really started to pay out financially. We worked with Spire. I mean, invested in Spire while I was there. So we're starting to see a real ROI dividend in RPM for the first time. And as that's happening, I think we can get into a snowball dynamic. People are trying to do more and more because they're starting to see the ROI. People generally do things that work and ramp that up. And we're starting to see success stories that are building on themselves. So I view that's kind of where we are right now.
Yeah. So interesting perspective in that yes, the elephant in the room is also always going to be who's going to pay for this, right? And so again, getting those answers, COVID gave us a little bit of a boost in that, it was something that was needed because hospital staffs were in huge demand. Patients couldn't see their doctors. So, there was that momentum that was created. But also, I think there's a value proposition here from the point of view of who pays for these services, but also from the value proposition of does this improve outcomes? Does it really make a difference to the patient and to the clinician? So obviously on the clinical side, we want to be able to create workflows that are time saving, but that don't allow data to fall through the cracks, so that there's better care and better follow-up with patients being discharged or that are being monitored at home. So, all right, so we have two areas here that are I would call them foundational to this conversation. And so, Dr. Jafri, if we go back to the question of the tools, what tools are you using at White Plains Hospital currently that helps you with this transference to home and our patient self-care and transition to home?
Right. So right now we are primarily focused on our congestive heart failure population. And we're actually expanding to COPD with spirometry over the next 4 weeks. And so we're actually just beginning to test that out amongst our team to make sure that we're ready with the data as we start expanding that population. For the congestive heart failure patients, we're focusing on blood pressure, heart rate, and doing daily weights. We are using the pulse oximeter, but for the most part, most of really our need is focused on the heart rate, the blood pressure, and their daily weights. But we're leveraging the remote patient monitoring program Forest, not just for an escalation pathway for when patients are beginning to gain weight or start, becoming very hypertensive. We're really looking at heart failure as a way of optimizing their medical management through guideline-directed medical therapy, which we know not only decreases hospital readmission, but more importantly, it improves, really decreases the morbidity of the patient, and is optimal for really their chronic disease management. And what's nice about looking at this data, and it's when we look at it at the end of an aggregate, where you could actually see a pre and post and clear delineations of what happens to their blood pressure and their heart rate and their weight fluctuality, the fluctuance of their weight when these medications have been optimized. And it's quite telling. It's a nice visual, right? To say, hey, not only are our patients feeling better, they feel a little bit more active by the end of the 30 days that we're watching them. We're doing a transitional period for them right now. But as we start expanding this into really more of a chronic disease and longer term management, we could also say, there's less variability in their blood pressure. There's less variability in their heart rate. They're less tachycardic. And they're able to, and then when we talk to them, they're also feeling improved in regards to just their overall functionality. So that's something that we can visualize, and then we could feed back to our cardiologists as really more fodder to really focus on, hey, can we treat these medications a little bit more? Can we optimize them a little bit better? And being more proactive about their optimization, rather than having to rely on kind of these isolated follow-up appointments.
Right. So you see this impacting a variety of different areas. So it's not just the creating the awareness for the patient of their conditions, right, on a daily basis. Even sometimes on continuous monitoring, for example, we'll give them a basically almost a minute by minute accounting of their situation. But also the ability to for the clinicians to actually have actionable data where they can now go and alter, change medication, right? See what the impact of that does, or change things like something as simple as, you should add exercise to your daily regimen, right? Or things like that, and see where the changes are going. Sometimes they're subtle and sometimes they can be very pronounced, right? So, but it's something that you weren't able to see on a day-to-day basis. You only saw it before, occasionally when the patient showed up. And something I've discovered with our customers is that sometimes when that patient went in, it was a bit too late, right? It's now they could not effectively do as much as they could if they were aware of the situation on an ongoing basis. So interesting. Since digital healthcare has a variety of different tools, do you utilize other ways of doing assessments? And I bring that up just because we also provide, we work with Avicenna, which does our assessments and surveys and things like that to get non-digital data. It's digital in the form of being able to ask the patient questions and things like that. Do you use any tools like that for patient engagement?
Not yet, and I think, you know, we've trialed a few different programs, but we do have a very robust program, and this fits into our program model, right, where we are already outreaching patients. And, you know, even taking a couple of steps back before we even engage with remote monitoring, the question on our end is, you know, what's the problem that we're trying to solve, and is this actually going to fix that problem? And we're finding out that most of our COPD patients are coming back because they're having, you know, GI bleeds. Then the spirometry is not gonna help us, right? And so the question for us is, like, what are we trying to solve, and how, and what is it going to do for us? The other aspect of it is also technological literacy with our patients, and what are they going to be able to engage with? And we want to make sure we're not overwhelming them with too many things, right? So, you know, when we first started this program, we had all these new devices that we were really excited about, and we flooded our patients with them. We're like, we have this medication, this device that'll help out you. We had remote therapeutic monitoring, we had remote patient monitoring, but we realized that we really needed to simplify this process for them. And even as we look into future state, right now, we're still asking them to do a lot, right? Sometimes it's a lot for somebody to weigh themselves on a daily basis every morning, or to, you know, make sure they remind themselves to check their blood pressure. So how do we still simplify this process? So I think for us, it's about what do we need from them that we know is going to help optimize their medical care? How do we engage them in their health? Provide them that feedback also. So not only are we feeding back the physicians, but the patients are beginning to realize is, hey, on the weekends, I seem to be gaining weight, right? Maybe there's something different about what I eat on the weekends than what I eat on the weekdays. And, you know, they're beginning to start realizing that, you know, there's you know, something that happens that there's a cause and effect for them. And being able to help them identify that has also been, you know, very it's been great in that setting too, because as we eventually move them back to their primary care physicians, how are they going to continue to manage their disease chronically? But yeah, there's a lot that we can continue doing when it comes to patient engagement and asking surveys and things along those lines. But for us, when we identify a problem, we actually just outreach these individuals directly, and we'll go through we have a specific protocol and escalation pathway built out for them.
Gotcha. So you do have a vetting process that basically ascertains the level of technology savviness, let's say, to, you know, that the patient can actually use. And I really like your point. I think this is really critical. And Sean, I'm going to ask you the same thing, but in a different way. I believe the trend right now is really on keeping things simple, right? I think the part of the patient engagement, the hurdle is overwhelming the patient, as Dr. Jafri said, right, with technology. And so, Sean, do you see other things on the horizon there in your travels? You just came back from a trade show, and you know, again, I'm curious to see what you've seen and what you think on the technology side.
Well, I can pile on the first comment you just made about keeping it simple. Yeah, before I worked with White Plains and East Coast Road Ventures, I was with Philips as a venture leader there. And when you look at what they were doing with PAP therapy, they need to keep those PAP devices connected to the cloud so that data can be pulled off the devices for further titration of the settings, and also to track the health and performance of the patient. And so the least expensive way to do it is by Bluetooth, but that requires you to a Bluetooth transceiver, just so you know, is about $1 at a parts level in China. But then you've got to have somebody with a savvy to pair it with a phone, and then the phone paired to the cloud. You've got to put an app on your phone. That was a wipeout. Financially, that looks like a great thing to do. Everyone should be able to do that, but in reality, that was not successful. It just wasn't easy enough. The next level up in cost was with Wi-Fi, That part costs something around $8 or $9 at the part level, but then you have to then make it part of your Wi-Fi network. That also wasn't successful. So what ultimately succeeded from a business standpoint was putting a full-blown cellular transceiver inside the box with its own cellular subscription, so that the patient just plugs it in and it works, and every so often is chirping out the data. So you can see where, yeah, there's a good example where the cheapest solution isn't necessarily the best business proposition or the best clinical proposition, because it's got to be easy. So it's just a lesson learned there. What was the second half of your question, Mario?
Again, as in the simplification of it, what trends do you see in the industry right now towards that?
There's a lot of new devices coming out that are capturing things that 10 years ago we wouldn't have thought was possible. For instance, the Abbott has a Libra device, which is this incredible thing. It attaches in the back of your arm. Little tiny needles go in through the skin and is capturing capillary blood, and it has a wireless capability to get that data out into the cloud. So it can do real-time blood monitoring. That is absolutely amazing. We've got other companies just coming out now that are doing interstitial fluid monitoring, where they're using electrophoresis to open up the pores in your skin, draw out interstitial fluid, and can capture real-time information on what's going on at the interstitial level. Like, for instance, if one of our patients had a hip transplant, or hip replacement rather, and have just left home, and they're now in Farrukh's program, and they're in transitional care. We hope they don't have to come back to the hospital and be readmitted in 30 days. You can put one of these Kific devices on there, near the incision points of the surgery, and it can look for indications of sepsis before the patient's even aware of it. That can be communicated to our WPH care teams if we were to employ this device, and we could get on it before the patient even knows they're becoming septic. We would know they're septic.
Right.
So there's such an incredible array of interesting technologies coming out that the area, this area of medicine is just fascinating. It's just so much happening.
Yeah, definitely. Every week here at Life365, we get 1 to 2 devices, new technologies, and the simplest technologies, from wearable patches, for example, again, where you just put it on. I call it the set it and forget it, right?
Mm-hmm.
It's already communicating with a device, maybe a cellular hub or something. It's sending the data in to the patient. They don't have to even think about it, right? I think part of the complexity of taking your blood pressure or any reading, with a device, is the simple fact that they actually have to do it, right? Physically, they have to take it. I think the future is going to be the devices that we set and forget. We walk away. They last for 30 days, 60 days, whatever the time that the batteries will allow, and the measurements are coming through. They don't have to think about it, right? So definitely, that's something that's showing up more and more.
And it becomes a challenge for you, I guess. You need a system like Life365 that can have a very flexible data schema, because you're going to be looking at data types coming in that you probably didn't even imagine when you started creating your company.
Exactly.
So I'm sure you have a very flexible schema that can accommodate all these new data types.
Yep. So that you got my curiosity up when you said interstitial. So I've not encountered that before, so it's going to be fantastic when we do see more.
That one's in FDA right now, but that one's going to be a hot ticket. It's got Quest involved, and it's got some big Sand Hill Road investors. So that one's coming down the pipeline. So you should probably start looking at their data types.
I will definitely do that. Dr. Jafri, back to you on the we've gone through the teething pains. We've gone through 2 or 3 different versions of implementation of, for example, an RPM program within White Plains. Where do you see where you have had success in that implementation, and how did you do that?
Right. We scaled up very slowly, and we realized we really needed to start with one individual, one patient, once we identified, the problem that we were trying to solve, and identify what the barriers for that individual as we began to scale up in this type of programs. I think for us, when we look at the congestive heart failure population, this is a very sick population. They tend to be an older population. We found a lot of problems with really tech literacy, right? And especially when it came to the mobile application. You know, when we talk about mobile-based devices, you know, what I hear regularly is, well, almost everybody has a smartphone, right? But does everybody know how to use and be able to integrate a smartphone? And right now, there are apps for everything. It's you know, I bought a humidifier for my kid, and now I have to download an app to be able to control it. It's kind of somewhat excessive in certain areas, right? But I could just go over and just press the on button. But at the same time, like for our patients, they weren't using the devices because of their difficulty with being able to engage with mobile devices. And it may have not just been downloading an app and using an app. It could have been the most simplest app, but it was, does Mrs. Jones remember what her Apple ID password is? And then we found out that our clinical team became really more tech support than actual clinical focus. So we realized that we needed to overcome the tech barrier when it came to literacy in order to be able to be able to engage our patients. And with that tech barrier also came an equity barrier, right? So basically, if patients didn't have broadband internet at home, if they didn't have access to a smartphone, if they struggled with being able to navigate some of these processes, then basically instead of narrowing the equity gap, we were going to be widening it, right, by focusing on a certain population. So that created a selection bias there too. So we identified this very early on, and we thought to ourselves in the planning stages, like, how do we overcome this? You know, the hub system that you guys have developed has really been critical for us. And what I mean by that is really focusing less on what the patient has as their baseline and just giving them the devices and saying, all you got to do is step on the scale and check this blood pressure. We'll set the rest up for you. And we set it up at their homes. And this really allowed us to improve the volume of patients. Right now, we have more demand than we have supply when it comes to remote patient monitoring congestive heart failure. And we're beginning to now need to really scale up in terms of our devices, because we have patients just waiting to get on our program. We've been able to demonstrate impact when we talk about ROI when it comes to hospital readmission and being able to optimize their medical therapy and engage them with cardiologists, which has been important also. But when it comes to the patients, the reason we've been able to be so successful is we really helped them. We understood what their barriers were going to be, and it took some time, right? It took us really interviewing them and saying, why are you, how can we get this to you? And it also showed in our demographic data, right? We were able to really improve the diversity of the patients that are enrolled in our program, which told us that, we're really on the right path in regards to making sure that we're implementing a program that is going to be really impacting every individual that comes through our walls, and not isolating different individuals based on their social determinants of health, which was an important lens to look through.
Exactly. Yeah. So the personal touch is critical to success here, because that as a technology guy, I've come to realize that automatic doesn't really exist, right? People are not going to onboard on something without some hand-holding, and we found, depending on the populations, that disparity that exists out there is really probably the biggest barrier to entry for anybody using new technologies. And so congrats on your success with that program. We really think that the ability to actually help onboard that patient in their homes is actually a very important factor. If of all of the factors that are out there, I think that's the second one we've discovered is really the fact that in many cases, once we've determined social determinants of health, is who's providing care for some of these patients. Many times it's family members, right? And so being able to create technology that's friendly across the board so that a family member can take care of an elderly patient, for example, is actually been something that's been, and we've been very successful in implementing. So going back to some questions, you mentioned that you were looking at expanding the program in other areas. Which areas and how, where are you planning to expand to?
Sure. I mean, I think what we're looking at is, without just looking at the devices, we're looking at what are our needs, right? And so I think we've identified COPD as an area that we could really focus our attention on. And we are identifying that most of our COPD patients, when they come back to the hospital, they're coming back because of a COPD exacerbation, right? It's increased shortness of breath. So there's an opportunity to focus on, can we, capture these patients earlier, and be able to, turn their course, allow them to recover at home, once we identify a drop in their lung capacity, right? So that's something that we'll be using through spirometry, and we've been coordinating with our pulmonologist. Diabetes is a big one for us. I think Westchester County, where White Plains Hospital is located, certainly there's a lot of disparities in care when it comes to diabetic health and diabetic mortality. Being the biggest hospital in Westchester County, that really gives us a good opportunity to make an impact here. And so, working with our diabetic population with continuous glucose monitoring, and having a proactive approach is something on our list. And of course, we're looking in the future when it comes to, maternal health, when it comes to, postpartum eclampsia and hypertension. Right. This is a period of time where these patients are generally very high risk if they're being discharged home, and being able to actively monitor their blood pressure while they're home, and being able to engage with both them and their obstetricians to make sure that they have a safe transition home, and they're as they're going through a very complex time period. I think it's gonna be important. So then there's certain things on our horizon, but of course, well, we have a nice vision in front of us. It's a lot of hard work to get through each of these different areas. And then I'm fortunate to have people like Sean that that sets up meetings and says, hey, I found a bunch of new devices. And then we start looking at, well, like understanding what our focus and opportunities are. How does this fit in, right? So, and there's sometimes they're great devices, but it doesn't fit when it comes to a problem, right? So the last thing you want to do is fit a square in a circle.
Right.
So you want to make sure that it's actually going to help solve a problem. It's going to make it easier for the patient, and that the device that you're going to implement is going to provide equitable care.
So that brings up a great point, and question for Sean. So Sean, as you're talking to all these companies in digital health, in the digital health space, what advice do you have for these companies to be, to how they approach a healthcare system, with their technologies? Because I think we all get overwhelmed. There's just so much going on. But what advice would you give them?
I'd say on a couple levels, make sure you've got yourself well sorted in terms of how the data is going to flow into some place where it's useful. Just assuming that the healthcare system is going to magically translate their information into our EHR is probably not the safest of starting points. So I would say that's a sort of I see that a lot, where some startup has solved some pain point or developed a device that does something, and they haven't thought all the way through how the data is going to get where it needs to go. Some basic blocking and tackling, and how are you going to get that into people's homes and get them trained and getting them using it and keeping them compliant. And I'm seeing some interesting things happening there. I just came back, as you know, from Vive, and one of the biggest vendors there was Best Buy. They have Geek Squad. They've got people go into homes and set things up and get them working. So they see great potential for their Geek Squad capability. And they like to sell electronic devices. So I think Best Buy is clearly putting effort into becoming a different company that we knew in the past, not always selling you a music maker, but maybe something that's capturing your blood oxygen or your blood pressure, or your pulse, or your body weight. So they see themselves as increasingly becoming a health care focused company. And that's an interesting development. And it's something that I think that a lot of these startups could potentially leverage, understanding how they can pair up with some old line companies that have some capabilities that maybe they didn't consider. I think there's other disease states that we could start looking into as well. I mean, Farrukh just hit the greatest hits there, the diabetes and COPD, et cetera. But we might get into behavioral health at some point. I think the technology to track people's behavioral health just by listening in on your phone calls and listening to very subtle cues using AI to figure out what your psychological state is. I think behavioral health is a huge area that we're not looking at it yet as a priority for us, but I think we probably will at some point. Fertility as well, the whole 9 months gestation period is probably an RPM opportunity that needs to be considered. There's care throughout that continuum, and I'd love to see us move into those areas. But I don't get to make the clinical decisions.
Right.
That's Farrukh and others. But I can see what's going around out there, and figure out, and I can present those to our clinicians to figure out what's going to be clinically useful. Fads go around. It was blockchain, it was big data,
Right.
it was there's always a fad. And AI has got elements of a fad. It's replaced blockchain as the new coolest thing to say. Fads and trends aside, there are a lot of really important innovations happening with the AI right now. That one's not. This is a fad that's going to stick. I think we're pretty confident there. But all of the many ways that AI can be useful, I think there is some smoke and mirrors out there. But it's a good time to keep your eyes open and to just sort of canvas the landscape of all of these AI-driven potentials, because there's a lot out there, and we're already taking advantage of some of them, but there's just so many. You really have to boil the ocean, unfortunately. But that is my task.
Yeah. No, that's an exciting stuff. AI, I think it is going to play an important role in the future of medicine and digital healthcare. It's a question of when it's ready, when it passes all the regulatory hurdles that are out there. But in a way, we're already using AI as part of decision support and other factors that are brought to the table for the care of patients. Again, it's a lot of it is just logic, right? That's used. But I think it's more. It'll be more used for really decision support, right? And so it's a tool that a clinician can use to help them come up with the best results. But just so you know, we do have a session on AI coming up. So I think that'll be a very exciting session. And I'm sure there'll be naysayers and very positive people, and then people are going to be over the top and they're going to take over the world and our jobs. But we'll save that one for the next session. So we've got some time here, and one of the things I did want to ask is, sometimes the best way to measure success is to look at where we've really made a difference using technology for the patients themselves, right? Either through better outcomes or a resolution of an issue. And Dr. Jafri, do you have a sample or a thought of a case, where this really made a difference for that patient?
Yeah, I mean, we had a individual with heart failure that was discharged home, and his blood pressure readings, I mean, despite a very low EF, he was very hypertensive. And we had to frequently adjust his blood pressure medications. But we really identified that really nothing was happening, and his blood pressure was continuously 180 over 110, 190 over 115. It was just very high blood pressures. We had him seen by his cardiologist. We plugged him right in, but still, a lot wasn't happening. In our detailed question, as we were kind of reviewing his medications, and this is all prompted by the fact that even if I just called him, he had no symptoms, right? But if I didn't have RPM, it wouldn't have kept bothering us, and we kept digging in, and we realized that he had just had very low literacy levels, and just he wasn't taking his medications right. He just was unable to read his medications, and what he thought was his blood pressure medication was actually his cholesterol medication. And so he was taking the wrong medications, and he was doubling up on his cholesterol, not taking his blood pressure. And so we kept adding more on there. And at a certain point, if he realized that it may have become dangerous if he took them all at one time. So we coordinated with one of our local community pharmacies, and we delivered medications to his house in a pack. So all he had to do is just open up the packs and take the medications. And we slowly trended his blood pressure down to really impressive levels, to where they were almost near normal by the end of a 30-day period. And moving forward, that local pharmacy coordinates with his cardiologist for any medication adjustments that need to be made to have them directly delivered to his house. I mean, we have several cases like that, right? Where basically patients are just so excited that they're now being engaged with their health, that we have this one person that just, even though he graduated from our program, he still has the devices. He's no longer getting Bluetooth, but he calls us every once in a while just to let us know what his blood pressure is. Right. He graduated 6 months ago. But he's still checking it on a day-to-day basis. He's engaged. He understands what it means. So a lot of this, the patient education and engaging them in their own health is such an important part of this. Such an important part of making sure that they understand the implications of their disease and why we're doing what they're doing and how it impacts their health, and more importantly, how it impacts what they want to do in terms of their goals, right? For them, like, they don't care if they gain, some people may not care if they gain 4 pounds or lose 4 pounds, but they may care about being able to walk to church on Sunday, right? And understanding the implication that if you're gaining weight, as you're walking, you're going to make a more shorter breath. It's going to be more difficult for you to do so. Like putting that in a context that makes them understand what their goals in their life are and how this is going to help them, or may not help them attain their goals, is kind of how we like to put the whole package together and make sure it's patient centric. Yeah. So that has been an important part of it. We have a ton of stories like this.
That's awesome. It's really the benefits here are creating awareness with patients of their own health, what they can do to improve that health. It creates the awareness for the clinicians to be able to impact that patient with therapeutics, medication, whatever it might be. But it's also potentially something that's really interesting to me is really the future here is that it also can unify or involve more care providers into the program, right? And so now, as you mentioned, you have a pharmacist involved, you have, you may have a specialist involved, right? And you have their MD. So I think the future is looking very bright, but I think that it's a unifying, the type of product in that it creates this overall awareness to all parties involved, and then hopefully that for better outcomes for the patients. And then not to mention the potential financial rewards of basically helping lower readmissions, lowering cost of care, all of those things that also help keep our hospitals running. It's really at the end of the day is also a financial issue, but it keeps the priority of keeping the patient and their wellness there. And that's something else for another time. But health and wellness is really part of all of this, right? So being able to be preemptive, and I love your example of the patient that kept their devices and are able to monitor themselves. I mean, that, in a perfect world would be optimal. So I just kind of my last question, and we'll leave some time for some questions. Dr. Jafri, Sean, if you had a wish in digital health, not a want to have, but a need to have, absolutely need, totally would be a dream product for you. What would you be looking in for?
I do have an answer to that. Tying things into Epic at the data layer, very difficult, time consuming, permissions. It can just be the thing that kills your progress. So easier methods for getting data in and out of your EHR instance. In our case, we're an Epic shop. That's a really important wish list, and we will probably invest in a robotic process automation company near term for doing some of those data exchanges at the interaction layer, meaning through the browser. We're using virtual admins to go into your EHR to capture, say, doctor schedule information, rewrite over the new schedule that you of time that you're claiming. To going in as a human admin would be, but doing it robotically. And by going in at the interaction layer, it's not as elegant from a technical standpoint. It's better to have an HL7 FHIR integration, but that may take a bunch of years, and you may be wrestling for years with permissions. If you can go in at the interaction layer, at the browser layer, it's not as technically elegant, but it's more available and it's more timely. So one of my great wish lists is for us to develop out a better RPA, or robotic process automation capability, so we're not always waiting on the perfect data layer integration, so we can just get things moving at the browser level. And for many things, schedule is a good example, which is so important. That is a functioning, so that you can create a functioning solution at the interaction layer with robotic process automation. You don't necessarily need the deep HL7 or FHIR integration. So that's on the top of my wish list.
Yeah, no, that's excellent. We have a lot to talk about, and something just to mention that we are integrating with Microsoft Cloud for Healthcare that basically allows you to do that at the web level, right? To be able to get that and directly go into your EHR software, Epic specifically, but we are working towards that. And also even with the at the device level, right? Being able to go directly, there's just so many steps, hops and skips that happen to have, and it's all part of this whole who owns the data, who wants the data, who wants to control it. But that is also something that we would love to see, and I'm sure a lot of people would like to see. So with that, we're 10 minutes or 9 minutes into it. So I wanted to open up, Kendall, do we have, so if anybody has any questions, go ahead and put it into the chat, and we'll try to answer those. So I'll open it up to questions. I'm just going to see if there's any so far. And so far, no questions.
We did a really thorough job, I think.
Interesting.
Let's hope so. Hey, and just some of my background, I've been in digital health for 15 years, but I spent 30 years in video games, and the back of my brain works in how do I engage players, right? And I would love to see in the future of a way of actually engaging patients, different ages, different demographics, in a way to really think of their health as part of their everyday. It's not, we think in terms of streaming shows on TV.
Mario, there's some cool stuff happening on this front. Do you mind if I jump in? So you've got Lenovo doing some things, and some smaller companies. We're talking to SphereGen, where so your CT study or MR study, which is some technical imaging exercise that a patient normally does and gets a text-based readout, but that same study can be turned into a three-dimensional rendering of you. And so you've got companies that are, Lenovo has just acquired a Canadian company whose name escapes me, where the patient can put on a headset and look at their own anatomy in 3 dimensions. And if they have, a broken bone, they can actually start to understand what that broken bone actually it looks like in 3 dimensions using a VR, AR headset.
Nice.
That's other things that are being done with tumors, and that's being used for patient education, so they understand where that tumor is. And sometimes that's important for the doctor from a permission standpoint. If a patient has a tumor in a very difficult to operate place, they have to get, especially when it's a child, getting the parents to sign off on that surgery can be difficult. And if you can show the parents and the care team and the family members exactly what's going on with that tumor, where it is inside of the skull, if it's a neurological thing, and understanding exactly why it's going to be difficult and understanding all the ramifications. And apparently there's some data that's suggesting, from SphereGen anyway, they've done a white paper on this, that it can be a useful tool for getting parental sign-off.
Mhm.
But I think there's more to come on turning these CT and MR studies specifically into three-dimensional renderings that a patient
Right.
can be involved in. And there's all sorts of issues there. You know, you could scare a patient. You don't want to do that, but you can also get the patient more engaged in their own health. I think there's definitely more to come there. You've got big companies like Lenovo putting real money into it. I think it's still a little early to know exactly what that's going to look like from a consumer standpoint, but they're clearly going after the consumer as a consumer of their own imaging information
Yeah.
in ways that are much more consumer friendly.
Yeah. So somebody mentioned to me that you know, the way we can now manipulate images, right, through AI. One of the things that's very motivating for weight loss, for example, is, you know, is to be able to see what you would look like 30 pounds lighter, and then use that as a motivator to for your goal, right? And as you're getting to that goal, things like that, you know, which are, you know, they're borderline entertainment, but the reality, it's about engagement, right? It's getting your attention, getting your focus in that. So I definitely agree with you. I think that there's so many things there that are coming down the pipeline that
Well, sometimes engaging people in ways that are visual and it seemed fluffy at first end up opening new doors. Like, for instance, fractal science, or it's a branch of mathematics. It'd been around for a long time. Nobody actually turned fractals into pictures until the 1980s. And when people started to see fractals, they started to understand how interesting they were. And now they're using fractals to design new data structures, and they're using them to help them design the latest computer chips. And it was something that was viewed as a sort of a fluffy exercise of visualizing a mathematical equation, which was a fractal, has opened the door to whole new areas of math and manufacturing. So I shouldn't be too quick to poo-poo the visual sometimes. Sometimes it opens doors.
No, exactly. Well, I think that's our time. I want to thank our distinguished panelists for all of the information they've given us and thoughts, and really appreciate your time. And if you have any questions, please feel free to email us or send us through the chat here. We'd be happy to respond to you. And then just a reminder that this has all been recorded, so it's available for viewing at any point, or for sharing with fellow professionals. So thank you all for attending. Really appreciate it. And we look forward to talking to you on our next webinar. Thank you all.
Thanks, Mark. Take care. Bye.